What happens if I pick the wrong Medicare Part D plan? Have you ever wondered what could happen if you choose the wrong Medicare Part D plan? It's a question that many people face when navigating their healthcare options. Picking the right plan is essential for managing your prescription drug costs and ensuring you have access to the medications you need. First, let's talk about costs. If you select a plan with a high deductible or expensive copayments, you could end up paying much more for your prescriptions than necessary. Some plans have cost-sharing strategies that encourage the use of specific medications. If those medications do not align with your needs, you may find yourself spending more out of pocket. Next, consider the coverage. Each Medicare Part D plan has its own formulary, which is a list of covered drugs. If your medications are not included or are placed on higher cost-sharing tiers, you may struggle to obtain them or face higher costs. This can be frustrating, especially if you're relying on those medications for your health. Another important factor is coverage gaps and caps. Recent changes have introduced an out-of-pocket spending cap, which will be around $2,000 in 2025. However, if you choose a plan with less favorable terms, you might reach this cap later or incur higher costs before you do. Additionally, some plans impose restrictions like prior authorization, step therapy, or quantity limits on certain drugs. If you select a plan without understanding these restrictions, it could complicate or delay your access to necessary medications. Also, think about supplemental benefits. Some plans offer enhanced benefits that can help lower your total costs. If you miss these options, you might miss out on potential savings. When selecting a Medicare Part D plan, it is essential to review your current medications against the plan's formulary. Compare premiums and other cost-sharing features. Look at any additional benefits or restrictions that may apply. This careful evaluation can help you avoid unnecessary expenses and ensure you have access to the drugs you need. If you realize you have chosen the wrong plan, don't worry. There are opportunities to switch plans during specific enrollment periods, like the annual election period or special enrollment periods if you qualify. In summary, choosing the wrong Medicare Part D plan can lead to higher costs and limited coverage. It is vital to compare plans based on your medication needs and costs to find the best fit for you.